Hello, my name is Lillian Schmitz. The date is March 24th of 2021. On the back side here, I just got all the bones written down so I can follow along during my presentation. So I've got my skeleton guy here. I took his head off so we can get a closer look when we're going over the cranial and facial bones. So first, we're going to go over the axial skeleton. So the axial skeleton is the skull and the associated bones, as well as the vertebral column and the thoracic cage. So we're going to first look at the skull here. So like I said, the skull is going to consist of the cranial and the facial bones. Your cranial bones are separated by sutures, and sometimes sutural bones will form between these sutures during development. Not everyone has them, but they basically form just between these suture lines, so it's almost like just an extra bone in there. First, we have the occipital bone, so that's on the back here. And again, all these bones are separated by sutures. Next, we have the parietal bone. That is these ones up here on the side. Also, all these bones are considered flat bones. Next, we have the frontal bone, so that's this front one right here. Temporal bones, so that's on the side here and here. The sphenoid bone, this side is a little better, but if you look closely, there's like a little wing that comes out, and so the wing goes behind the orbits and the nose, and then comes out the other side. So that sphenoid bone is just going to go behind the face here. And then the ethmoid bone, that one forms part of the orbital wall and the roof of the nasal cavity and septum. That bone you can't really see on this small model, but the ethmoid bone is going to be like right up in here. It's going to go behind the face. Again, it's hard to show on this example, but the ethmoid bone is an example of a pneumatized bone, and that is a bone with a bunch of air pockets in it. Next, we'll go over the facial bones. So first, we have the maxillary bones. So that's going to be these ones right here, the top part of your mouth. And it kind of goes up under the eyes as well. Next, we have the palatine bones. So that is going to be that one you also can't really see, but it's basically behind the roof of the mouth here. And they also form the posterior floor of the orbits. Next is the nasal bones. These are just right here. That's the top of the nose bone. This one is pretty small, but it's there. There's your nasal bones. Next is your inferior nasal concha. So these you can't see on this example, but they are scroll-like bones inside the nose, and they create turbulence when you breathe in air. Next, we have the zygomatic bones. So that's right here and here. Your lacrimal bones, can't see on this. It's pretty small, but those are they're basically where your tear ducts are. So they're in that medial part of the orbit. Next, we have the vomer. So the vomer is the posterior. It's like this posterior lower nasal septum, so that you can't really see it in this, but the vomer goes, it's like in the back of the nose, right down the middle. Basically, it's like a plate. Finally, we have the mandible. That's just that lower jaw here. It's your mandible. And then associated bones with the skull, you have the hyoid bone. This skull does not have it, but it's kind of like a floating bone, like right here, basically. And that bone moves your tongue and your larynx. And then you have your auditory ossicles, which are the 3 bones in each ear. Next, we'll go over the vertebral column. So we have our vertebral column is right here. These are each vertebrae is an irregular bone. It's an example of an irregular bone. First, we have our cervical vertebrae, so those are your first 7, and they end at the first rib, where the first rib articulates with the first thoracic vertebrae, and that's where your cervical vertebrae end. And then you have 12 thoracic vertebrae, and then finally where your rib articulates with that last vertebrae and your thoracic vertebrae, that's when your lumbar vertebrae start. So then you have 5 of those. And then we also have the sacrum, which is right here, and these are fused vertebrae, and then the coccyx, which is also known as your tailbone. Next, we'll go over the thoracic cage. So your thoracic cage is going to consist of your sternum and your ribs. So ribs 1 through 7 are true ribs, and as you can see here, they're truly connected to the sternum. Next, you're going to have ribs 8 through 10. So these 3 are going to be false ribs, because as you can see, they're not connected to the sternum directly. And then finally, you can look through the back here. We have ribs 11 and 12, and those are floating ribs. So as you can see, they are not connected to the sternum whatsoever. The sternum right here has 3 parts. So you have the manubrium, I believe that's how you say that, and then you have the sternum body, and then the xiphoid process. Next, we're going to go to the appendicular skeleton. So the appendicular skeleton is going to be your pectoral and pelvic girdles and your upper and lower limbs. So we're going to start up here. So first, we're going to go over your pectoral girdle. So that's going to be your clavicle, which is right here. It's an S-shaped bone. And then back here, we have your scapula. So both of these are your scapulas. And then we have the upper limbs are on that girdle, on that pectoral girdle. So we've got our humerus. This is an example of a long bone, which means the bone is longer than it is wide. We've got if we're looking at the skeleton in anatomical position, so that is thumbs or palms facing up. So the thumb side is going to be your radius, and then this side is going to be your ulna. We also have 8 carpal bones. So the carpal bones are examples of short bones. So we have 8 carpal bones. So first we have on the distal thumb side here, we've got our trapezium, and then your trapezoid. We've got the capitate, the hamate, and then moving up to the more proximal carpal bones, we've got the scaphoid. Then we've got the lunate, the triquetrum, and the pisiform. You've also got 5 metacarpal bones, so that is going to be 1 in each digit. And then you have 14 phalanges. So you have a distal phalange, which is at the end, a middle phalange, and a proximal phalange. Except at the pollex, which is your thumb, that one is only going to have 2 phalanges. Next, we'll go down to your lower limbs. So we have the pelvic girdle here. Your pelvic girdle is going to consist of your hip bones. So you have 2 hip bones. Each consists of 3 bones that have fused together. So we first have the large superior portion here. This is your ilium. This anterior portion here is your ischium. So you have this ischium here, left and right. And then finally, you've got the pubis. And then the pubis is the more posterior portion here. And it's also where the femoral head is going to articulate. Next we'll move down to the lower limbs. So we've got our femur, our patella right here. That's the kneecap. And this is a sesamoid bone. Next we have the tibia. So that's the bigger bone. And then the fibula, the more lateral bone here. Next we have the tarsals. So the tarsals are going to be your ankle bone. We have 7 tarsals in each foot. So your tarsals are going to be composed of your calcaneus, which is your heel, and the more proximal. Here, let's get the other foot over. So then we have the more proximal bone up here. That is going to be your talus, and then we have the navicular. The cuboid is this lateral bone here, shaped kind of like a cube. And then you have your cuneiform bones, your cuneiform tarsal bones, which are going to be a lateral, intermediate, and medial cuneiform bones. Finally, you have 5 metatarsals. So that is going to be the same as like your fingers. You're going to have 5 metatarsals, 1 for each digit, and then 14 phalanges. So just like your fingers, you also have a distal, a middle, and a proximal phalange. And then your hallux, your big toe, is only going to have 2. So you're just going to have a distal and a proximal phalange. So that is the skeletal system. Last thing is, one way that I can relate this to a clinical study or clinical anatomy in my profession, which is veterinary medicine, is that we often use radiographs to look at broken bones or see the progression of arthritis in patients, and then make a treatment plan for them using that information. Thanks for listening and have a great night.